Proposed federal cuts to Medicaid, SNAP, and the Affordable Care Act coverage could deeply impact South Carolinians. We want to welcome Sue Berkowitz of South Carolina Appleseed Legal Justice Center, who joins us to explain what's at stake and what you can do. Thank you so much for joining us.
Oh, thank you for having me.
So it's sitting in the Senate right now. We could see a vote imminently. What would be the risk to South Carolinians should there be cuts to the programs that I mentioned just a moment ago?
Well, the risks are going to be great. And really, it's not just for those who have Affordable Care Act coverage or Medicaid coverage. It will impact every South Carolinian because as cuts are made or extensive cuts are made to people having health care coverage, we know that the providers, and primarily, especially the hospitals, they have to get paid. They can't do this work for free. And so that, we know that when there's greater uninsured rates, that there's cost shifting to those of us who have private, are lucky enough to have private coverage. But for those who are on Affordable Care Act coverage through the marketplace and those who are on Medicaid, we are looking at, for Affordable Care Act coverage, I've seen some numbers that have been quoted by Kaiser, that we could have over 200,000, close to 230 to 270,000 people lose their health care coverage with the loss of the enhanced APTs. But in addition to that, because of all the red tape that they're putting in front of people, I mean, they're trying to do what they weren't able to do head on, which is just get rid of the Affordable Care Act by making it so administratively burdensome and difficult for people that many people will find themselves locked out of the system. They won't have as much time to reapply. For those who had automatic enrollment, they're not going to have that automatic enrollment. They're going to have to find documentation of certain things that they have not had to document before, that may not be that easy to find. And all of that has to be put together, and all of it has to be reviewed before approval can happen.
Who's most vulnerable? Yeah. Who are the most vulnerable populations?
Oh, well, for the Affordable Care Act, I think all people who are on the Affordable Care Act are very vulnerable, but those who are of the lowest income are going to be really impacted, because we have a lot of folk who are on the Affordable Care Act, and with the enhanced APTs, that's the subsidy, they're able to get the silver benefit, which allows them to get it without any cost. Now, if that goes away and the cost sharing goes back in, someone who had a zero premium, it could go up $200, $300, and they could then be on the hook for another $900 or $990 of cost sharing. And the rules are being changed. They just got finalized on Friday to say that if you don't pay your cost sharing, providers can just not see you. We also know that for people who may have underestimated what they thought their income was going to be, or they lost some of their income during last year and they had a higher APT than they should have had, they're going to be required to pay all that back before they're allowed to go back into the program. I've heard it referred to as death by 1,000 cuts, and I think it's incredibly appropriate. And when we think about what the uninsured rate was before the Affordable Care Act, we're going to be looking at those rates again on top of the Medicaid cuts. And the Medicaid cuts are going to make it incredibly difficult for folks. They're going to have to recertify every 6 months. They're going to have to prove their citizenship every 6 months. Even though they're already on Medicaid, they've proven it. There's going to be efforts to take away Medicaid from those who are lawfully present.
It sounds like it's a job in and of itself just to maintain it. And with just a minute left, we only have about 60 seconds left here, but Sue, you say that it's going to impact the infrastructure here. So how is that going to affect, say, our hospitals and our healthcare providers?
Oh, it's going to be devastating. First of all, there may be some changes to how we do our hospital taxes and how those are used to have the match. It also the way that they're getting paid. There's a direct payment that they could get that for some states was up to 110% of the Medicare rate. That's going to be cut out. And there's not going to be retroactive coverage. If it takes 4 months for somebody to get approved, and they were in the hospital, not only is the hospital not going to get payment for that stay, the individual is going to have incredibly high level of medical debt. And South Carolina already has the second highest level of medical debt in the country.
Goodness. Well, this is a conversation that I think we could speak on many more segments. So we'd love to have you come back and further this conversation with us. Thank you so much, Sue, for joining us.
Sure, my pleasure.
We're back after this.